Hi Bella, how are you doing?
Hi, I'm okay.
Okay, so what's going on? What brings you in today?
I'm having some upper back and neck pains.
Okay, when did this start?
It started about a month ago.
About a month. Okay. Do you think it's getting worse? Do you think it's just the same but not going away?
It's the same, but it's just annoying me.
Okay. Did you notice any changes a month ago? Maybe a change in your workout routine? Maybe some specific activity that you did that you don't normally do?
I have been pushing myself harder during workouts.
Okay. So you think it might have been something to do with what you usually do, like lift weights or?
I lift weights.
Okay. Did you notice, like, while you were lifting weights, maybe you pulled on something, or like, can you pinpoint what is it that happened, or it just like after you worked out or whatever, it started hurting?
It was I was doing the squat machine.
Okay.
And I did about like 200 pounds, but I felt it in my back.
Okay.
Yeah.
Okay, and then since then, it's just the pain's there, not getting worse, same, but it doesn't go away.
Yeah.
Okay, very good. So yeah, I'm definitely gonna take a look at your spine and your back. I also want to take a look at your posture and your gait. Make sure there's nothing that's causing any misalignment down in the base of your body, which is your feet, your knees, ankles. So we'll take a look at that as well, okay?
Okay.
Now I'm going to ask you to please stand up, and you're going to take a few steps for me. I'm just going to be looking at your gait, your posture, and the position of your ankles, hips, and knees, okay?
Okay.
I'm going to be moving the chair out of the way. Okay. You can stand right here to start with, and I'm going to have you walk that way. Okay. Can you go ahead and turn around? Come back. Okay, we're going to do the same thing one more time. Again, you're going to walk that way. Okay, go ahead and come back. Okay. So I do notice your arches on your feet are a little bit low. Have you noticed that before?
Yeah, I have flat feet.
Yeah. So yeah, they're pretty low. Okay. That gives me good information. I'm going to have you stand right here, looking towards the wall. Okay, Bella, I'm going to be putting your hair up. I'm going to be able to look at your back and your spine. Okay, I'm going to be taking a look here. Okay, can you go ahead and stand straight? Give me like the straightest that. Okay. So I see a little bit of the head being a little bit forward. That's pretty common nowadays since we're looking at our phones probably more than we should. And probably looking at like working on a laptop or something like that. Sometimes we keep our gaze down. Okay. I'm gonna try to feel your spine. Okay, overall it feels pretty symmetrical along the midline. However, I do notice your left shoulder is quite higher than your right. I'm going to go ahead and take a few measurements here. Okay. Okay, yeah, we have about 2 centimeters. You go ahead and shrug your shoulders for me. And try to push down. You just try to resist. Keep them shrugged. Yep, like that. Okay, go ahead and relax. Now I'm gonna put some resistance and try to shrug your shoulders again. Okay. Okay, now I'm gonna ask you to do a few movements for me. Go ahead and try to touch your knee alongside your body. So you're gonna flex your spine kind of like sideways, as far down as you can go. Does that hurt?
A little bit.
Where does it hurt? You can come up. Where do you feel it?
Right here.
Up here, okay. Let's try the other side. Okay. Does that feel the same? Does it feel different? Does it hurt somewhere else?
It feels the same.
Same, okay. Now I'm going to have you try to touch your chin to your chest. Okay. Take a few measurements here. Okay. Okay, go ahead and relax. So we've got about 28 degrees. Now try to look up as far back as you can go. Okay, very good. So 84 degrees. Okay. Okay. Check for temperature changes. Would you say my hands feel the same temperature to you as I slide them down?
Yes.
How about now?
Yes.
Now?
Yes.
Now?
Yes.
Okay. Okay, I'm gonna again try to confirm the symmetry of your spine. Okay. Okay, now I'm going to be making a vibration and I'm going to be placing the tuning fork along your spine. Let me know if you feel it and when it stops, please. You feel that?
Yes.
Did you feel it stopping?
It stopped, yeah.
Okay. When it stops, just let me know and say stopped. Do you feel this?
Yes. Stop.
Okay. Do you feel this?
Yes. It stopped.
Okay. You feel this?
Yes. It stopped.
Okay. Do you feel this?
Yes.
Did it stop?
Yes.
Let's try again. Do you feel it?
Yes. It stopped.
Okay. Do you feel that?
Yes. It stopped.
Okay. Do you feel this?
Yes. It stopped.
Do you feel this?
Yes. It stopped.
Okay. Okay, that gives me a pretty good idea of what's going on with your back right now. I do think there's a lot of tension. Possibly you're not lifting symmetrically with both sides of your body. So one side is more tense than the other. It's causing some misalignment and some pain. Okay, so now I'm going to have you lay down. You're going to place your face right here. Okay, I'm going to be removing the hair tie. Okay, so I'm going to first start massaging the neck area. Using the Gua Sha tool. Okay, I'm going to try to release any tension that's currently stored on the base of the neck. Do you mind if I take off your necklace?
Mm-hmm.
Okay, got it. Okay, so we're trying to release tension and warm up the muscles before we go in and do the neck adjustment. So we're trying to also signal to the body that there's a need for increased blood flow in the area. And by rubbing on the skin and even rupturing a little bit the fibers on the muscles, the body's trying to regenerate them and helping heal. There might be a little bit of redness, but it's just the massage working. Okay, Bella, now I'm going to ask you to go ahead and flip looking up. So now I'm going to be adjusting your neck. You can go ahead and lay down. Just leave all the weight of your neck on my hands. Let's start by doing some mild traction to your neck. Not just pulling. Make sure that we open up the spaces on your spine in between every vertebrae. When we spend a lot of time looking at our phones and kind of like with that forward position, there's some compression of the cervical spine. And make sure that we elongate. Okay, now I'm going to be doing some adjustments. I'm going to be adjusting your neck. It's going to probably, you'll hear a crack here and there, but it shouldn't hurt. Okay. Just going to ask you to leave the weight of your head on my shoulder, on my hands. Go ahead and take a deep breath for me. Exhale. Okay. Do the same thing on the other side. Go ahead and take a deep breath for me. Exhale all the way. Okay. How does that feel?
Good.
Okay, now we're going to let your neck rest. We've done a lot of work on that area, so we're going to be moving on to the rest of your body. We'll be adjusting your hips, your legs, hands, and just relax. Okay, I am going to be adjusting your hips first. We want to make sure that your legs are symmetrical. Okay. Okay, so your left one's a tiny bit shorter than your right. Might be just posture misalignment. So I'm going to be pulling on your leg just to adjust the hip joint. Go ahead and give me a deep breath. Okay. One more time. Go ahead and give me a deep breath. Exhale. Okay. Let's look at them. Yeah, they look a lot more even now. Okay, that's great. And now I'm going to be adjusting your toes. I'll be pulling on them. Okay. Stretching the middle of the foot. Okay. Okay. Just trying to stretch the muscles around the arch. Since your arch is pretty low, there's a lot more pressure that's applied to this area. You try to push on my hand with your, okay. Strength is normal. Go ahead and push my hand. Okay. Okay. I'm going to be adjusting your hands. Okay. I'm going to be adjusting your fingers. Do you ever crack your fingers? Not usually. That's good. It's good to do it if you know how to do it, but some people can end up hurting themselves. Okay. Okay. Very good. Okay, Bella, can you go ahead and again lay down on your belly? We're going to be adjusting your back and doing some cupping therapy. Okay. Good. Start just feeling the muscles of your back. hair to one side. Feel a little bit of tightness on the muscles around the neck area, the shoulders, basically the trapezius, the elevator scapula. Lower back, pretty good. So I'm definitely going to be focusing more on the upper area. Let's start with some pulling therapy. I'm going to be pulling the skin to allow for some movement. Does that feel okay?
Yeah.
Okay. Feels a little bit looser, less tense. So now I'm going to be doing some cupping therapy. So this is what this is helping with. It's creating some suction that's rupturing the fibers. Similar to what we were doing with the Gua Sha tool. This is a similar effect, but this can actually go deeper in the tissue. And it is promoting the regeneration of the fibers on all your muscles. We are doing very mild suction. It's different from the therapy for high performance athletes. Okay, I'm going to go ahead and do a little bit of massage before we go in and adjust your back. Okay. Make sure that I release any knots around the scapula. All the muscles in this area are so important to stabilize the cervical spine as well as the neck. Okay, so now I'm going to go ahead and adjust your back. Okay, go ahead and take a deep breath for me, please. Exhale. Apply some pressure. Okay. Okay, one more time. Go ahead and take a deep breath. Exhale. Okay. Turn it more towards your lumbar spine. Go ahead and take a deep breath for me. Exhale. Okay. can go ahead and sit back on the bed. That's it for today's session. We can discuss the next steps. Okay, so how do you feel after the treatment?
I feel better.
Yeah? Can you go ahead and do a few movements, feel your neck. Let me know how it feels. Do you feel like a bit less tension, less pain?
Yeah, I feel lighter.
Yeah? Okay, that's great. We can do this again next week. I think it would be beneficial for you to have one more treatment, and then next week we could reassess and see if you would need more sessions, or I can maybe give you some exercises for you to stretch at home to help with that tension, kind of like a little bit of misalignment on your cervical spine. Okay?
Okay.
Do you have any questions?
No.
No? Okay. Well, it was very nice meeting you. Thank you.
Thank you.